Good morning, everyone. And if I could start by sending a message of thanks to all of the communities across the Cooke electorate for their support and their efforts over the Easter period, and in fact for several weeks now, as we come to terms with life as it is at the moment under a new set of rules which are really designed not to punish us but to protect us. We've done a fantastic job over the Easter break, and since the last update that I was here for last Wednesday, we've had just one additional case in the Cooke-Gundagai Regional Council area, and no others, which is fantastic news. 4 of the LGAs in the Cooke electorate, of which there are 9, still remain COVID-19 free, and that's very, very encouraging. But my message to the community is similar to that of those that we've heard before us this morning with Jill Ludford and Superintendent Noble. We need to make sure that we keep up this very good work to protect the most vulnerable in our communities. The reality is that we have wonderful, small, beautiful rural hospitals. They have served us very well for many, many, many decades, but they aren't built for pandemic circumstances and the like that we are experiencing now. So it's important that we don't see a hotspot develop in any town or community in the Cooke electorate, where we do have a lot of oldies, we've got a lot of vulnerable people, a lot of people with underlying health conditions. And so finally, I'd like to say today to people who are at home and feeling vulnerable, please reach out. We have a dedicated hotline, 137788. If you're feeling lonely at home, please give us a call. And to other people across the electorate, please keep up the good communication that I know is happening, whether it be over social media or just on the old-fashioned telephone. Please keep up that level of communication, because whilst people are alone in their homes, we don't want them to feel lonely. And I think as a community, and small communities are wonderful at this, we're really, really great at pulling together in times of need. And now is such a time. So on that note, I'd just like to encourage everyone to keep up the great work. Let's keep the pressure off our hard-working health professionals and our other frontline services, and all of us to continue doing our part as we move through the weeks ahead. Thanks. I'll now hand over to Member for Wagga, Dr. Jo McGurk.